بسم الله الرحمن الرحيم. Intramuscular injection presented by Jehan Mohammed Amin, lecturer of pediatric nursing, Faculty of Nursing, Cairo University. Definition: intramuscular injection is a method of administering medication directly into the muscle tissue. Purpose: deliver a specific medication that's not recommended for other routes. Obtain the faster rate of absorption than the subcutaneous because increased blood vessels in the muscle tissue. Administer drug that is irritant to the vein. Intramuscular injection used when the vein cannot be located. Sites for intramuscular injections: deltoid muscle, vastus lateralis, rectus femoris, ventrogluteal and dorsogluteal muscle. Deltoid muscle: age and volume, advantage and disadvantage. The age for deltoid muscle over 1 year. Volume for 1 year child 0.5 milliliter. Older child 1 to 2 milli. Advantage: faster absorption than other sites because of increased blood vessels. Disadvantages: injury to the brachial artery and or radial nerve if landmarking technique is poor and the injection is given too low. Limited volume of medication, not suitable for repeated injection because of small muscle mass. Site of the muscle: the thickest part of deltoid muscle is 2 finger width below the lower edge of acromion process. The bottom edge is at imaginary line drawn from axilla. Injection site is 3 to 5 cm below the acromion process over the mid-axillary line. The second muscle is vastus lateralis. The age for vastus lateralis muscle: infants and children up to 2 years of age. The volume for infants 0.5 to 1 milli. For older children 1 to 2 milli. Advantages: site is easily accessed. Large muscle mass to absorb the medication. Used usually for vaccination because it is normally developed. Disadvantage: inaccurate location of the site will result in damage to the femoral nerve or the femoral artery. Site of the muscle: identify the greater trochanter of femur and the knee. Divide the muscle into thirds. Vastus lateralis site is in the lateral middle third of the anterior aspect of thigh, between the greater trochanter of femur and the knee. The third muscle is rectus femoris. Age and volume: the age for rectus femoris muscle used for infants and children up to 2 years of age. The recommended volume for infants 0.5 to 1 milli. For older children 1 to 2 milli. Advantage: site is easily accessed. Disadvantage: the injection can cause considerable discomfort. Site of the muscle: visually divide the length of the muscle that originates on the greater trochanter of femur and the knee into 3/3. The middle third is the site for injection. The fourth muscle is ventrogluteal. The recommended age: after 7 months of age, and the preferred age is the adolescence. The volume for infant greater than 7 months of age 0.5 to 1 milli. Older child 1 to 2 milli. Advantages: thick muscle mass, free of penetrating nerves and blood vessels. It has a thinner layer of fat than is present in the dorsogluteal site. The disadvantage: landmarking technique is not appropriate or reliable for use with young children, owing to the differences in the anatomical size of the child to the adult. Site of the muscle: placing palm of opposing hand on greater trochanter of femur, so the thumb faces the groin. The index finger of the hand is placed on anterior superior iliac spine, and the middle finger stretched dorsally towards but below the iliac crest. The V is formed, but the index finger and the third finger, and the site of injection between index and middle finger. Dorsogluteal muscle is the last one. Age: it is not recommended for infant, toddler and preschool. The recommended volume for children 1.5 to 2 milli. Advantage: large muscle mass to absorb the medication. Disadvantages: it is not the ideal choice for a child less than 5 years. Too much fatty tissue leads to poor absorption rate. Risk of injury for the sciatic nerve and superior gluteal artery. Site of the muscle: the dorsogluteal site is above an imaginary line between the greater trochanter of femur and the posterior superior iliac crest. Injection is administered laterally and superior to this imaginary line. We have another way. You can divide the buttock to 4 quadrants, and you can give the medication in the upper outer quadrant. Special considerations we have to consider before giving intramuscular injection for children: age of the child, the size and accessibility of the muscle. The muscle must be well developed and capable of tolerating the volume of medication to be administered. In the rare occasions of repeated intramuscular injections being required, then rotation of sites into more developed muscles is preferential. The type of medication being used and the manufacturer's instructions. 10 rights of medication are very important: medication, patient, dose, route, time, documentation, assessment, patient education, evaluation, and right to refuse. Calculation of the medication dose. We have 2 equations to calculate the medication dose. The first one is drug dose, ideal dose. Drug dose equal ideal dose multiplied in patient weight and divided on frequency, that will equal the drug dose by milligram. The second equation is practical dose, that equal drug dose multiplied in dissolvent solution and divided on drug concentration, that will equal the dose by milliliter. We have some examples for clarification. The first one is Rosfin, 500 mg. Child should receive 100 mg per kilogram per day. Ampoule is dissolved in 5 ml and administered 2.5 ml per 12 hours. Child weight is 5 kilograms. Solution: drug dose equal 100 multiplied in 5 and divided on 2, that will equal 250 milligrams. Practical dose equal 250 multiplied in 5 and divided on 500, that will equal 2.5 milli. The second example is Amikin, 250 mg dissolved in 2 milli. Child should receive 15 mg per kilogram per day. Dissolve 1 milli in 10 milli normal saline and administer 2 milli per 12 hours. Child weight is 3 kilograms. 1 milli equal 1 multiplied in 250 and divided on 2, that will equal 125. Drug dose equal 15 multiplied in 3 and divided on 3, that will equal 15 milligrams. Practical dose is 15 multiplied in 10 and divided on 125, that will equal 1.2 milli. Third example is Lasix, 40 milligrams dissolved in 4 milli. The child should receive 4 mg per kg per day. Dissolve 1 milli in 10 milli normal saline and administer 2 milli per 8 hours. The child weight is 4 kilograms. So the drug dose 4 multiplied in 4 and divided on 4, that will equal 4 milligrams. Practical dose 4 multiplied in 10 and divided on 10, that will equal 4 milliliters. The last example is Zantac, 50 milligrams dissolved in 2 milli. Child should receive 4 mg per kilogram per day. Dissolve 1 milli in 10 milli normal saline and administer 2.7 milli per 12 hours. Child weight is 4 kilograms. So 1 milli equal 1 multiplied in 50 and divided on 2, that will equal 25 milligrams. Our solution: drug dose equal 4 multiplied in 4 and divided on 2, that will equal 8 milligrams. Practical dose 8 multiplied in 10 and divided on 25, that will equal 3.2 milliliters. I have finished my intramuscular injection, and I will start subcutaneous injection. Definition: subcutaneous injections are administered into the fatty tissue found below the dermis and above muscle tissue. Indication: medications are given into subcutaneous tissue when a slower rate of absorption is desired, because fatty tissue has fewer blood vessels than muscle. Possible injection sites for subcutaneous route: top of the belly, at least 2 inches away from belly button; back of upper arms between elbow and shoulder; lower back or top of the buttocks; outer thighs. I hope you have benefited. Thank you so much.
Wash hands to prevent possible infection. Prepare all needed equipment to save time and effort. Wash hands again. Wear sterile gloves to minimize transmission of microorganisms. Verify the right of medication to avoid medication errors. Prepare the medication from vial. Attach the needle to the syringe without removing the protective covering to minimize the possibility of infection. Remove the soft metal cover from the vial. To reconstitute the drug. Disinfect the rubber septum of vial using alcohol swab to avoid possible infection. Twist the top of reconstitution ampoule. Insert the needle into the ampoule of reconstitution solution and withdraw the appropriate amount. Inject the reconstitution solution into the vial and take the needle off. Check the vial well to dissolve the powder. Put an amount of air in the vial equal to the volume of drug that will be withdrawn to facilitate withdrawal of medication. Draw up the prescribed amount of medication. Pull the needle out of the vial. Cover from ampoule. Remove the liquid from the neck of the ampoule by swinging it fast. Use goes around the neck of ampoule and carefully break off the ampoule. Protect your fingers from injury. Draw up the prescribed amount of medication. Pull the needle out of the ampoule. Cover the needle immediately. Remove possible air from the syringe.
Remove the possible air. Remove the possible air. Have an assistant or parent to hold the body parts of the child during the injection to allow the procedure to be done safely. You can ask the mother to help you during administering the medication. Locate the site and clean with alcohol using outward circular motion and allow the alcohol to dry. Locate the muscle. How to locate the muscle? How to locate the muscle? For example, we can give the medication for this patient in vastus lateralis muscle. The first step, we have to locate the muscle. How to locate the vastus lateralis muscle? You can remember what I'm saying. 2 fingers below the greater trochanter of femur and 2 fingers above the knee to divide the thigh to 3/3. The vastus lateralis muscle will be in the middle lateral aspect of thigh. In the middle lateral aspect of thigh. Okay? You can ask the mother to restrain the baby, to give the medication safely. Pinch the muscle, but before pinching the muscle, we have to clean the site of injection by using cotton with alcohol by circular motion. By circular motion. Pinch the muscle between thumb and index finger or your non-dominant hand. We have to pinch the muscle. We have to pinch the muscle by this way. Pinch the muscle by thumb and index finger. Remove the cap from the syringe. Insert the needle quickly at 90-degree angle. Remove the needle and insert the needle by 90-degree angle. Insert the needle by Insert the needle by 90-degree angle. Insert the needle by 90-degree angle. After that, aspirate to check the blood. If present, remove the needle, replace with sterile one and start over. If when you aspirate, you observe blood is in the syringe, if you observe any blood, you have to remove the syringe and prepare another one. If you observe any blood in the syringe after aspiration, you have to remove the syringe and prepare another one. Push the plunger gently but rapidly. Push the plunger gently but rapidly. You have to push the plunger. After that, withdraw the needle and press gently. Withdraw the needle and press gently. Don't recap. After that, don't recap. Place adhesive bandage over the site if needed. We can place adhesive bandage. If you observe any oozing at the site of injection, you can put adhesive bandage. Don't recap the needle. Discard it in puncture resistant container. You have to discard this needle in the puncture resistant container. After that, clean and return the equipment. Clean and return your equipment. Record the medication name, dose, route, site, time, signature, and reaction of the child to provide documentation that the medication was administered. Have the family member to comfort the child or using toy to promote positive relation and reduce the effect of painful procedure. I finished the intramuscular injection. Now I finished the intramuscular injection. After that, I will explain the subcutaneous injection. Are administered into fatty tissue found below the dermis and above the muscle tissue. Subcutaneous injection are administered into the fatty tissue that found below the dermis. The dermis is the second layer of the skin. The skin is What about the structure of skin? This is the structure of skin. This layer is called epidermis, and this layer is dermis. And this is the muscle. The subcutaneous site into the fatty tissue found below the dermis. This is the fatty tissue that found below the dermis and above the muscle tissue. You will give the subcutaneous injection in this layer. The indication: the medication are given into subcutaneous tissue when the slower rate of absorption is desired because the fatty tissue has fewer blood vessels than muscle. Okay? The equipment: prescribed medication, cotton balls, antiseptic wipe, syringe with appropriate size, adhesive bandage, non-sterile gloves. Procedure: wash hands to decrease the transmission of microorganisms. Prepare all needed equipment to save our time and effort. Check the 10 rights of medication to avoid the medication errors. Check the amount of medication to be administered by look at the patient file to observe or to recheck the drug prescription that prescribed by the physician. Choose the appropriate needle gauge and length for the medication, child size and site. No more than 0.5 ml to small child or 1 ml to preschool age or school age child. Number 6. Choose the most appropriate site considering the adequacy and the condition of subcutaneous tissue and duration of therapy. Apply non-sterile gloves. Apply non-sterile gloves. After strict hand washing, apply non-sterile gloves. We apply non-sterile gloves after preparing the medication. If you prepare the medication, you have to wear sterile gloves. If you prepare the medication, you have to wear sterile gloves. But you can wear clean gloves or non-sterile gloves when you give the medication after complete preparation. Remove the needle cover. So after I prepare the medication that will be given in subcutaneous site, I will remove the cover. I will remove the cover. Hold the syringe with medicine like you are holding a pencil. You have to hold the syringe as you hold a pencil. As you hold a pencil. And start to assess the site of subcutaneous injection. With your other hand, pinch the outside area of the skin that was cleaned with alcohol with your index finger and thumb. Clean the site with alcohol. By circular motion. And pinch the outside area. Quickly push the needle into the skin at slight 45-degree angle. After inserting the needle, insert the needle. Before insert the needle, you have to pinch the skin by thumb and index finger. Pinch the skin. After you pinch the skin, you have to hold the syringe as or like you hold the pencil and insert the needle with 45-degree angle. You have to not insert all needle. You have to not insert all the needle. You insert the part of needle as you reach the subcutaneous layer. Relax the pinched skin and slowly push down on the plunger. Slowly push down on the plunger. Okay? After pushing down the plunger, pull the needle out quickly at the same angle that it went in to allow medication to flow into the tissue. Cover the side with cotton ball or gauze pad if needed to prevent infection. Apply the bandage if needed. Document the procedure in appropriate patient record. After that, you have to document the procedure in appropriate patient record. Remove and clean the equipment. Wash hands. Report for any abnormality, as skin color, bleeding, skin hematoma, or edema. What about the sites of subcutaneous injection? This is the last point. Outer area, the top of the legs or belly, 2 inches away from the belly button. 2 inches away from the belly button. Back of the upper arm between the elbow and shoulder. Lower back or the top of the buttocks, outer thigh. So we have 4 sites for subcutaneous injection. The first one is the outer area or the top of the leg or belly, at least 2 inches away from the belly button. Back of the upper arm between the elbow and shoulder. Back of the upper arm between the elbow and shoulder, between shoulder and elbow. Lower back or... What about the possible injection sites for subcutaneous injection? 4 sites. The outer area or the top of the leg or belly, at least 2 inches away from the belly button, in the abdomen. For intramuscular injection, the outer area, the top of the leg or belly, at least 2 inches away from the belly button. The first site for subcutaneous injection is in the belly or abdomen, in this site. This site is a site for subcutaneous injection. This site are suitable for subcutaneous injection. The second part or the second site, back of the upper arm between the elbow and shoulder. Back of the upper arm between the elbow and shoulder, in this site. This site is suitable for subcutaneous injection. The lower back or top of buttock. The lower back or top of buttock. The lower back or top of the buttock. The last site, the outer thigh. The last site for subcutaneous injection is the outer thigh. In this site, the outer thigh. Okay? I have finished our topics today. So today's we explain the intramuscular injection and subcutaneous injection. And we speak about the definition, the purposes, sites, and the procedure. I hope you have benefited. Thank you so much.